Thank you for joining us tonight for another in the presenter series, talking now to Roy Hunter. I'm Karen Hand, and joining me tonight is Suzy Day to interview this master of hypnosis. And I'm going to say that I've known Roy for a very, very long time. In fact, back in 2005, 2006, I was doing an awful lot of training with Roy Hunter. When I knew that I needed more training, that's the first stop for me. And there was a time when we thought maybe I should be the president of the Roy Hunter fan club. But before I fawn too much,
I feel honored. Thank you.
I want to turn this over to Suzy so we can be a little bit more professional about it. But I'm going to get him to tell you one of my very favorite stories in hypnosis before the night is over. So don't move a muscle. Sorry, Suzy,
Oh
it's
my
not
gosh.
you.
I'm already excited. Your very favorite story. Roy's name has been in my sphere of influence since I came into this world of hypnotherapy. And to continue tonight with our HypnoExpo stars and dazzling you with their brilliance, this is an opportunity for us to get, up close and personal with those who have kind of paved the way and expanded our journeys and the profession as well. And I'm honored this evening to introduce to you Roy Hunter, who Roy and I we haven't personally met, but he's one of those that I say has been in the profession since dirt was invented. So he's been around. Roy. I'm glad you giggle, Roy. I'm just glad to introduce you to another expert who's presenting at the Hypno Expo this year. Um, he has he's a published author and trainer recognized in America and abroad, of course. He's been around for like decades, of course, like I said, since dirt was invented. But he's presented workshops in over 20 different countries. Numerous awards or have been laid at his mantle. Lifetime Achievement Award from 3 different organizations. And he was inducted in the International Hypnosis Hall of Fame for his books. He's also a life diplomate of IMDHA and APHP. So welcome, Roy. I want to turn this over to you because I understand that you're instructing and bringing to our association and our conference parts therapy at 2 different levels. One is learning, and then 2 is being an instructor. So tell me what's important for our conference attendees to know about what you are bringing to the game in May.
Well, I have practiced client-centered hypnosis for almost 4 decades. I was originally certified by Charles Tebbetts in 1983. I did not know then that he was one of the most qualified instructors in the world and also a 20th century legend in the profession. He was the pioneer of parts therapy, which is a fabulous technique to help clients resolve inner conflicts. So during the first 2 days, Wednesday and Thursday, as a pre-conference, I'm teaching my parts therapy workshop for people who want to learn parts therapy. It's an awesome technique because even though a lot of people in our profession have been trained in regression therapy, a lot of people who do regression don't know about parts therapy or its variations. And sometimes regression isn't enough to help a client discover and release the core cause of a problem of a client. And I explain it simply to a client this way. Number one, it's important to know when parts therapy is indicated. And number two, if you don't know when it's indicated or whether it's indicated, then my workshop will include instruction on how to find out whether or not parts therapy or variation is indicated. But I explain it in advance of the trance to a client this way. I say, we all have parts. We wear different hats. Right now, I'm wearing my hypnotherapy cap. when I go home, if I've had a long work day and I want to do something fun, I put on my inner child hat, which enjoys having occasional R&R. But then when my wife and I want to do something, I put on my inner husband or inner romantic hat.
Too much information, Roy. Let's move on. I'm sorry. Go ahead.
Well, I like to explain the concept for people who haven't heard it.
I got it.
So I'll tell the client there's a part of you that wants to be a non-smoker or whatever the client's presenting problem is or goal, and there's motivated you to invest your time and money for these sessions. But there's another part of you that wants to keep on smoking or overeating or whatever the situation is. Otherwise, you wouldn't need my services in the first place, would you? So it's based on the concept that we have different aspects or parts of the subconscious. There are variations. So like ego state therapy, voice dialogue, the Hegelian method, which is also called subliminal therapy, based on the concept that we have parts. So different experts, not only in the hypnotherapy profession, but even in the psychology community and medical community, understand that we have different aspects. I have an inner child, an inner adolescent, an inner adult, an inner parent. And after I embarrassed myself not knowingly in several workshops in the 90s, telling people, I don't want any more parts, thank you, God. Well, after the turn of the century, I developed a new part. When my first grandchild was born, I found out I now have an inner grandpa. So we develop these parts as we walk through the timeline of life. And before Charlie passed, he asked me to continue his work with parts therapy. Although I included a chapter on parts therapy in The Art of Hypnotherapy, which is now in its 4th edition and used as required or recommended reading in many hypnosis schools around the globe.
And if you don't mind if I interrupt, Roy, that leads us to one of my favorite stories in hypnosis about how you actually did acquire Charlie Tebbetts' teaching. I know that you were his protege and you were in his training, but there was a specific night at a conference where you were asked to take over for him. And was it not his last night on the planet?
Yes, it was. He was teaching parts therapy at the NGH conference on the East Coast in 1992. And I was planning on attending out of support to him. I ended up attending as teaching instead of him because what happened is I got a call, and then Joyce Tebbetts walked in the room also because her husband asked her to see what kind of a teacher I was of the parts therapy. What happened is just a couple hours prior to his workshop, he passed away. He suffered a heart attack in the morning of the same day he was supposed to teach, which was, I believe that was on a Thursday. So Thursday evening, I had the sad duty of telling everyone that Charles Tebbetts passed away. And apparently, among some of his last words, when he knew he probably wouldn't get out of the hospital, he asked his wife to have me teach parts therapy instead of him. And I guess in his mind, that was a logical choice because a year earlier, he asked me to continue his work after he passed.
The mind is a powerful thing, and that's one of the parts of the story, Roy, that I think is really important, is as I understand it, and I believe the way you told it to me, was Charles Tebbetts was telling the doctors, I'll be fine. I'll be able to teach this. I'm a hypnotist. I can control my pain. And while
I just remembered something more accurately. Joyce didn't know that he had passed away. She had asked me to teach because he was in the hospital recovering from a heart attack. And then about part way through the presentation, she stood up and came towards me, and we took a break. And then one of the NGH officials came in and told all of us at the same time that Charlie had passed over. And then she told me after the workshop that the reason she suddenly stood up is she said that she saw Charlie standing behind me in spirit form, endorsing me as his protege.
The mind
You
is
know, you can't make this shit up.
the mind is a powerful thing, and Charlie was actually controlling his pain, believing that as long as he didn't have the pain, he couldn't be having a heart attack. So when someone comes to you for pain management, make sure that it's something that can be managed and not something that needs to be seen by, more advanced equipment.
I'll digress there momentarily. One of the things that got me interested in hypnosis was I suffered a permanent back injury in 1982. Hypnosis tamed it to a tolerable level because the doctors gave me a horrible prognosis that I would never be able to lift more than 25 pounds. I'm glad that was wrong because my wife packed 50 pounds in her suitcases. And also that I would never be able to do any physical work because I would be on daily pain medication for the rest of my life. Well, hypnosis helped me tame the pain from a 6 or a 7 on that 0 to 10 pain scale down to a tolerable 2 or 3. So I've been able to live a normal life, even though I have lived with chronic pain virtually every day for decades. That got me interested in hypnosis. What really made me passionate about parts therapy is I also had another painful situation ever since first grade. I got my first migraine when I was 6 years old. And when I went home and told my mother, that I felt like my head was going to blow up. And she asked me a few questions. And then she said, well, I suffer migraine headaches also. I don't know if you inherited it from me or not, but you're suffering a migraine headache. So I ended up having 2 or 3 annoying headaches a week, all the way through grade school, junior high school, college, and in my career, where I would just have to learn to try to forget the headache and work in spite of that obstacle. But when I started having 2 or 3 migraines, you can't work with a migraine. They would literally be so bad they would drive me in bed. And this went on from age 6 until after I got certified in hypnotherapy. And then trading sessions with another student. She did parts therapy, and that part of me that was causing the headaches called itself the judge. And when she said, what job do you do for Roy? The judge said, my job is to help him become perfect as the Father in heaven is perfect. And besides, Mom said no job is worth doing unless you do it right. So little did I know during all those years that if I got 98% on a midterm exam, that that was why I would get a headache that night. I was being punished because even though 98% was a solid A, it wasn't a perfect 100%. So anytime I failed to do something perfectly, I had a headache. And if it was an important job, like a midterm exam, it was a serious offense, so I would have a migraine instead of a minor headache. Not a clue at a conscious level that that was going on. I rightly suspected that some of my headaches were from stress when I would get insufficient sleep or lay awake part of the night worrying about something. And I thought that was the cause of some of the headaches, and indeed it was. But most of my migraines were because the judge didn't feel I did something perfectly. And one of the things I learned from Charlie is a mistake that a lot of people using variations of parts therapy make is they start dismissing parts. Tell it to go away if it's doing a bad job. Well, thank God Charles Tebbetts was more client-centered, because he said you don't dismiss a part or send a part away unless all the other parts unanimously want it gone. I've modified that during my career to if the higher power part wants it gone. However, what was evaded part, that's what Gordon Emerson calls him. He's a world-renowned psychologist and protege of John and Helen Watkins, who pioneered ego state therapy, which is very similar to parts therapy. What was a negative part for 3.5 decades took on a new job because the conflicting part said to, the healthy, my motivating part that wanted me to overcome the headaches, said to the judge, the conflicting part, the only man who was perfect got nailed for it 2,000 years ago. And the lady I swapped sessions with was very active in her church. And I still remember, even though I was in deep somnambulism, I still remember her bursting out in laughter at that unexpected comment. At any rate, she did parts therapy flawlessly. And then the motivating part, healthy, said, look, isn't it good enough, since nobody's perfect other than Jesus Christ, isn't it good enough for Roy to simply be the best he can be? And some days his best might be better than other days based on how he feels physically as well as emotionally. The judge agreed to that if I endeavored to be my best, he would back off on the headaches. Well, since that session, well over 3.5 decades ago, I can count on 2 fingers the number of migraine headaches I've had after suffering 2 or 3 a month for decades. To me, I thought it was a cross I was going to have to bear for the rest of my life. Thank God.
Isn't that a lovely testimonial of how to utilize parts therapy? Here's what I want to know from you, Roy. You've got two days before the conference where you're actually teaching parts therapy. You're going to spend some time really drilling down into that and helping your students learn how to recognize parts and when to use parts and how to call out the parts and how not to fire parts, but allow them to do, because the harder you try, the more they resist, right? The harder you try to get rid of them. All of that will occur in those first 2 days, the 2 days pre-conference. Is that true?
Yes, the first 2 days, that will teach you how to know when or whether to employ parts therapy. And I've evolved it into 3 phases: a preparation phase, which includes a pre-talk to the client, because I never facilitate parts therapy without a pre-talk in advance of the trance. So we'll go through the preparation phase step by step, which includes deepening to appropriate depth where you can get results. I've been on the receiving end of parts therapy where it was a waste of time because I'm analytical and the facilitator failed to get me to a sufficient depth of hypnosis, because a person has to be at least medium, if not deep, in order to have a successful parts therapy if he or she is analytical. So this will be covered in depth, the 6 preparation steps, and then I've evolved the actual parts therapy process into an 11-step process. And that protocol evolved a few times through the years based on successes and failures. And I share my failures with you as well as my successes, so you don't have to reinvent the wheel and make the same mistakes I've made. And then the protocol that is evolved throughout my almost 4 decades career has passed the test of time. It's not the only way to get results, And I do spend a little time in the first segment in the morning discussing some of the variations, because parts therapy isn't the only game in town. But just like there are several ways to do parts therapy, the metaphor is, if you're going from Los Angeles to New York, there are several different journeys you can take. You can take the slow route by driving, you can take a faster route by train, or you can fly. You can fly nonstop, or you can have a stopover in Chicago or Denver, but the destination is more important than the journey you use. However, the journey I use, which is I now call client-centered parts therapy, has passed the test of time to be very effective. And since one session changed my life for the better permanently, I really believe in parts therapy. It was life-changing. I could not be traveling to 20 different countries in the past 2 decades if I had to worry about having a migraine headache during one of those 2 days without having someone go with me as a co-instructor. So
You know,
the
Roy,
fact that
it is because of what I learned from you on migraine work and in parts therapy that I didn't work with someone else, but I was able to get rid of my own migraines in the same vein. I talk to my migraine as a part. What the hell do you want from me? I know you're doing something for me, but it would after a conference, after a special event, I would be shut down like you were talking about in bed from a migraine for a day or two. And that part told me, Roy, I want some rest time. You won't ever take any time off. We work and work and work. We come back and we work some more. You won't ever take any time off. So the only time you can get any rest is when I put you in bed for 2 days. And I said, oh my God, if I take a day or two off, will you leave me alone? And it said yes. And I have learned from that point on, thanks to that education, after a conference, I take a day or two off. If it's a long conference, I'll take a week off. I treat myself to the time off and have not had a migraine since.
God bless you.
How
Thank
about
you
it?
for
And
sharing that.
it's
That
that
reminds me of the session I saw Charlie facilitate when I studied with him. The guy was a police officer who took Charlie's course because he wanted to learn hypnosis and then specialize in forensic hypnosis. He suffered migraines. The part causing his migraines was doing it for the same reason you just described from your experience. He was a workaholic, didn't take enough time for himself. So that part caused his migraines to force him to rest. However, seeing that session was what inspired me to see if parts therapy could help my migraines. Although the part causing my migraines was for a different reason than yours or that fellow student of Charlie's decades ago. It's amazing. I used to say throughout the late 80s when I first started teaching, all the way through the 90s when I would teach my class at the college, and also when I would teach workshops, I would say, you have to be objective and not emotionally attached to the outcome. Therefore, I don't use self-hypnosis with my own parts other than to be aware of the parts. And then I changed that position after I met Bruce Eimer, clinical psychologist who came to one of my workshops after he'd been recommending my books, The Art of Hypnosis and The Art of Hypnotherapy, to other psychologists and physicians. He was an approved trainer of hypnosis for ASCH, you know, the people who used to call us lay hypnotists for decades. And then when we met, we sat down, had lunch together. We both shared the same pet peeve. We were really frustrated with all of the anti-regression people in both hypnotherapy and psychology who wouldn't do regression because of the mistakes that were made. So we co-authored The Art of Hypnotic Regression Therapy, a clinical guide. And not only did that build a bridge between psychology and hypnotherapy, it also made more people amenable to regression, because Parts therapy is great, but there are times when you need to use regression. And since part of the 2-day workshop is to find out whether or not parts therapy is indicated, we spend one segment covering idiomotor response questions, or now since Zoom has forced me to make adaptations, I use head nods and shoulder shrugs or hands raised for the I don't know or I'm not ready to disclose. And as we go through that, some of the yes answers would indicate regression rather than parts therapy. So it's obvious at times if a client comes in and says, well, I really want this to work, but there's a part of me that just keeps resisting these good suggestions you've given me. Well, obviously that's when parts therapy is indicated, but they're not all that easy. They're not all that simple. And client-centered hypnosis means you fit the technique to the client instead of trying to fit the client to your technique. And one of the biggest mistakes I've seen all through my hypnotherapy career is people who learn one or two techniques or approaches, and then they try to use that with all of their clients. There is no technique, including parts therapy, that is so good that it'll help all the people all the time. So if you use a technique that works with a similar situation for 3 clients in a row, and then you have somebody who resists it, I never forget how I felt when Charlie said change techniques in mid-trance. But how are you going to change techniques if you haven't learned a number of different techniques? So that's one of the reasons I strongly affiliate with the IMDHA, is because they require far more educational standards than most hypnosis associations in our country.
And in that parts therapy 2-day certificate thing that you will do, will there be a certification involved with that? Is that a certification in parts therapy?
The certification is optional. So people who want to be certified will email me after the conference, and they have to pass a written exam and also do 3 practicums, make a short report for 3 practicums. Otherwise, if they got certified as a parts therapy facilitator just for taking the workshop, how do I know whether they're competent? So I don't want to give them the certification as CPTF, which stands for Certified Parts Therapy Facilitator, unless they pass a test. And I can see from 3 practicums that they do a brief report on that they are able to practice what they learn. Does that make sense?
Yes, and they can go on then from this 2 days and do that practicum for you, and then you will give them the certification. If they pass it, then they get the certification.
Yes.
Ah, got it.
And if they want to become a certified parts therapy trainer, then that's where they would register for Monday and Tuesday post-conference. I have not only copyrighted participant workbook, which is referenced according to APA standards and comprehensive, but I also have, for their ease, a parts therapy PowerPoint presentation with over 100 slides to make it easy for them to teach the first few workshops. And it's optional after 3 parts therapy training sessions, whether or not they want to use the PowerPoint. But the PowerPoint tells you what to say, how to say it, and there are several segments where you'll hear my voice. And also, since Bruce Eimer was a pain psychologist and found out that you could use parts therapy in certain applications for chronic pain, he also has a segment in the PowerPoint presentation where you hear his voice. And we both closely examined not only the parts therapy participant workbook, but also the PowerPoint presentation so that it would be truly professional.
Sounds like a really rich and dynamic and comprehensive program, not only just learning the parts therapy, but also the training. What I find really interesting for even like, I'm thinking in terms of my new students who just went through my program as a CMT, IMDH, IX CMT, is
Mhm.
we can get ourselves boxed in to certain protocols that are required for
Mhm.
pain, certain protocols that are required for migraines, right? And it's important. Parts therapy I love is such a rich, diverse, expansive way to approach things that really don't show up as an inner conflict. Like you wouldn't say to yourself, or your client might not come in with a migraine challenge or a physical diagnosis or a physical pain challenge, and think to themselves that there's an inner conflict. But this pain, this is, I think, is really important for especially our new practitioners to understand that the applications are so diverse and so impactful, and this would really be something of great benefit for them to participate in terms of their expanded awareness and knowledge, even if they don't want to become a teacher, a parts therapy instructor, but they could still utilize this information in their practice as they go forward. Because I've utilized your books in my teachings. But I think that's also really expansive for people to understand the applications of parts therapy, not just inner conflict, what they might think is an inner conflict, but it'd be a really good aspect for them to consider, even if they don't even want to go on afterwards and become an instructor of it, but to fold that rich and dynamic and powerful technique into their practice. So I love that you're offering, the parts therapy instruction, the course, and those of us who might want to be certified as a practitioner, or excuse me, as an instructor afterwards, is very rich and diverse. And I
Thank you.
also want to inquire in terms of how would someone who's interested in becoming an instructor for parts therapy, how would they is there information about marketing or how to get that out, and that's also presented in the course?
Unfortunately, I have to admit, I am a lousy marketer. If I were good at marketing, I'd be a multimillionaire. But unfortunately, my best marketing tool is the quality of my work, and several professional marketers have told me that. So, for example, I wasted thousands of dollars early in my career marketing for new clients. I found out that the best way to get new clients when I was new was to give free talks to various organizations and also join the Chamber of Commerce and do networking. And then after a couple of years, half of my new clients were referrals from satisfied clients. So being good at what I do was my best marketing tool. And
which is a strong
also
testimony right there.
My books, word of mouth from hypnosis teachers around the world, help increase the annual sales of my textbooks, The Art of Hypnosis, The Art of Hypnotherapy, and eventually the parts therapy text, and then being invited to give workshops as a result of that parts therapy text. That was my visa to teach in over 20 countries since it was published, which is, in my opinion, an incredible honor and privilege that I value greatly, and I consider it an honor. So
And
other people have done my marketing for me.
I want you to know that IACT IMDHA value your relationship with us too.
Oh,
It is a mutual admiration society. So I do want to know
thank you.
though, if your parts therapy, if you're trained the trainer part, the post conference 2 day has a
Mhm.
prerequisite to it. Is there a prerequisite to taking that? You have to prove somehow that you know something about parts therapy.
The prerequisite is you have to have taken my workshop or a parts therapy workshop from one of my parts therapy trainers, or be trained in a variation of parts therapy years ago and have several years of experience. So any exceptions to the prerequisites have to be cleared by me before the IMDHA will let you take it. But to take the first 2 days, the parts therapy workshop, my recommendation there is that you had comprehensive training. And although it's not required that you have been trained in regression therapy, I recommend that before anyone who takes my parts therapy workshop uses parts therapy with a fee paying client, that they also get trained in regression therapy. But I've had many people take my parts therapy workshop who have not been trained in regression therapy, and I ask them to agree not to do parts therapy on a fee paying client until they get trained in regression, because on rare occasions, when you ask a part, what job do you do for Bob? The part will go into a spontaneous regression. And it's very important to know the difference between guiding and leading, as well as how to handle abreactions in a client-centered manner, and to also understand the risk of false memories. So I devote a little bit of time discussing false memories and the risk of false memories and the difference between guiding and leading in the actual parts therapy workshop, but I don't have time to train in both regression and parts in the same workshop. However, a little side note here is back in the 80s and 90s, we as a profession didn't have a fraction of the credibility we have today around the world. And that's because most hypnosis instructors in the 80s were not competently trained. And therefore, you know, many of them, if not most of them, relied mostly on scripts. I was fortunate to get one of the few quality training programs available in the 1980s. And then we were really criticized as a profession by the psychology profession. And I remember one time praying to God that someone would help build a bridge between psychology and hypnotherapy. Never in my wildest fantasies did I think I would be one of those bridge builders until Bruce Eimer and I became friends and colleagues, and the Art of Hypnotic Regression Therapy, a clinical guide, helped build that bridge. And then that bridge was turned into an interstate, to use a metaphor, or a freeway or a dual carriageway, when Bruce Eimer got approval from the American Psychological Association for CE, for psychologists. He has to approve the presenter, but I could be mistaken, but I believe I'm the very first person who was not a clinical psychologist to get approved for granting CE credits for psychologists.
It's one of the things
And
I
that
wanted to
was
ask,
history.
Mike. It's one of the things I wanted
Pardon?
to ask is that it does seem like a background in clinical psychology could be beneficial. You talk about ego states and you talk about, a lot of
Yes.
the fact. I want to know if an average general hypnotist who's been working in the field a year or two can come into this course and actually walk out with enough information that they can discern all of this and they can know all of this without having gone to 5 years of psychology training.
You can become very competent with parts therapy with A, willingness to learn, B, a background in competently trained client-centered hypnotherapy, and C, knowing when to refer. Because I have lost track of the hundreds of times I've had a client where I knew I was not qualified to work with that person. So instead of trying to see every person who darkens my door, it's important to know when to refer. So for example, if the core cause of a client's presenting problem is unresolved marriage problem, they need to be referred to a family marriage counselor, because you can't help a client release the cause of a presenting problem if the cause is ongoing. So when I go through the finger response questions or the ideomotor responding, or now I guess we need to come up with a different name because that might be head nods if you're doing Zoom. One of the 7 psychodynamics is current unresolved issue. And if that current unresolved issue is ongoing because of something somebody else is doing to your client, you are not qualified to help them unless you have training in that area. So another common example is if the problem is caused by unresolved grief from a recent loss of a loved one, they need a grief therapist, whether it's a psychologist, a psychotherapist, or a minister, or a rabbi, or a pastor. They need to work through that grief before they are able to get clear of it. So usually I won't do unresolved current grief, but I'll do unresolved past grief. If it's 2 years or more in the past, then yeah, sometimes parts therapy has quickly evolved into unresolved past grief. So that is one of the topics I cover in my first 2 days, how to do Gestalt role play with the departed loved one. And there have been several times where a parts therapy session, which I thought was traditional, quickly evolved into unresolved past grief because it turned out the cause of the problem was they never felt good about themselves after losing a parent or a favorite grandparent 5, 10, 15 years in the past. So what's important is to know when to keep them and help them, and know when to refer them. So I cover that in the workshop. The
You
first 2
mentioned
days.
a number of steps. You mentioned a number of steps. Are there, you might have mentioned 16. If one follows those 16 steps, are they pretty on track with doing some client-centered parts therapy?
Yes. Mm-hmm. And we will do some role play. And depending on the time, I will either do a live demonstration or show a video of a past demonstration, because people also learn by observing
Sure.
an actual session. But sometimes the role play ends up being sufficient because there have been a few times where the TV hasn't worked and nobody wanted to volunteer. And unfortunately, years ago, when I videoed a full 2-day parts therapy workshop in California, the lady who volunteered for the demonstration changed her mind after the session and she rescinded permission to show the video. I have to admit, I would not have wanted to verbalize what I was thinking because I was angry. It's like you don't volunteer and then change your mind when you know the conditions. So when people buy that instead of the demonstration that I wanted in there, which would have been excellent, I had to put an older demonstration of parts therapy into that video instead. So, however, don't worry, this is not going to be recorded. So if anyone volunteers for a session, I don't plan on recording this one in IMDHA this year.
You know, Roy, regression therapy.
You had a question?
Regression therapy and parts therapy, all of these things sound very psychology based, very straightforward, very strict, very analytical. You talk about being a very analytical guy. And I find it such an interesting juxtaposition that Mr. Analytics also does spiritual hypnosis. You go all the way on the other end of woo woo.
I discovered that by accident in the mid 1980s. A lady saw me for weight management. And as I was going through the 11-step process, the two parts could not come to terms of agreement because the conflicting part, the part that wanted her to keep on overeating, refused to budge an inch with the motivating part that wanted her to be at her ideal weight and have a more healthy diet. And then the stress was unbelievable. The two parts were arguing. And then I attempted to call out a third neutral part. And the conflicting part intimidated all the other parts into silence. So then I said, okay, time out, hold on, take a deep breath. And I used my own peaceful place trigger, which is a trigger for me to connect to my inner peace. And then I said, go way down. And as I was doing that, in the silence of my own mind, I was asking God for some intuitive guidance because this wasn't going by the book. And I immediately remembered that during the intake, she told me she was very actively involved with her church. So purely on intuition, I said, there is a part of you that is most closely connected to your perception of God or Jesus or Holy Spirit. So whatever part of you is most closely connected to divine, please come forward and provide some words of wisdom to get us past this impasse. And when you're willing to communicate, please move the yes finger or say the words, I am here. And after shouting with obvious anger in the tone of voice, this goddess-like voice says, I am here. I said, thank you. What name or title shall I call you? You can call me Holy Spirit. Holy Spirit told the other two parts what to do, and within 5 minutes, terms of agreement were reached and confirmed with finger response. And then the pounds started peeling off after that. Now, because I was teaching my course in a community college, I didn't say anything to my students in the class about that, even after I started teaching in a couple of years later, because I wanted to keep it secular and credible in the college. So what happened is there was no problem with client confidentiality with the client. So just a few weeks after her session, somebody comes in asking me if I can do spiritual hypnosis for her. So I discovered it by accident. And then over the years that followed, increasing numbers came through referrals. And I cover the last 2 hours of my 2-day workshop on parts therapy. I'll go into that a little more because basically I have a protocol that I've evolved, although I consider any hypnosis session where the client receives divine wisdom from his or her perception of God or higher power to be spiritual hypnosis. And in fact, one session I did years ago with a smoker, he came in 5 minutes into the intake. He said, I want to tell you something right now. I'm an atheist, I'm proud of it, and you better dare not bring anything religious or spiritual into these sessions. Well, since the client's my employer, I followed his wishes. So when he had two parts that would not negotiate with each other, they would not allow me to mediate. And in his case, I didn't ask for a higher power part. If I'd have asked for a higher power part, he would have probably emerged from somnambulism and remained a smoker. What I did is when the two parts wouldn't negotiate with each other, I said, Bob, whatever part of you can provide some words of wisdom to help us get past this impasse, you're a very important part of Bob. So whatever part of you can provide some suggestions or words of wisdom to help us get past this impasse, when you're willing to communicate, please say the words, I am here, or move the yes finger. And then in a lower voice, much more calm and mellow, I am here. Thank you. What name or title shall I call you? You can call me Higher Self. Higher Self told the other two parts to do, and he became a non-smoker. And at the end of a successful parts therapy session, my first words, oh, let me preface this by saying, if any of you didn't learn this from your hypnosis trainer, a person is still open to suggestions the first few moments after emerging from trance. So that's not the time to say, if you have any problems, call me, because you're planting seeds of problems hypnotically into the client's subconscious mind. So after a successful parts therapy session, my first words are, isn't this amazing stuff? He said, amazing.
With that, Roy, I'm going to have to say that's the tease to take your pre and post conference workshops. And in between, while you're at the conference at the HypnoExpo, go by his table and chat with him, because he'll be there and he's open to talking. Here, I'm going to admit something to you, Roy. A part of me has been so enwrapped, so mesmerized by our talk, that I missed my deadline for getting us through here. I completely lost track of time, and I've held everybody after class. It was worth it, though, wasn't it? Roy, I thank you. I appreciate you, and I want everybody to know.
Don't we go till 7:30? I mean, don't we go till half past the hour, or no?
45. I've been told 45 minutes, and we started at 9. Now, we started a moment or two late, so I gave you, let's just say I gave you a moment or two more. How's that? But the truth is, you'll get the most out of Roy Hunter by taking his 2-day pre-conference on parts therapy and his 2-day post-conference on training the trainer parts therapy.
Thank you. When I said amazing stuff to this atheist, he said, amazing isn't the half of it. Higher self was a spiritual part. If I have a spiritual part, there must be a spiritual realm, and logic dictates there must be some sort of God or higher power. So he left my office on the 3rd session believing in God, but because it came from him instead of me.
Right. I think you're some pretty amazing stuff, Roy. Can't wait to see you in Orlando in person. It's been a long time. I want a hug, and we will be there. We'll all get together.
You got it.
Before, 2 days after, and the conference, the HypnoExpo 2022, is May 13th, 14th, and 15th. We'll see you there.
I apologize for going over time, because I thought it was...
Roy. It's all my fault. I was just too hypnotized. See y'all.
Practice long and prosper.
See y'all next week for our next series in the presenter series. Thanks very much. Suzy, thank you very much.
Thank you. Thanks for playing. Thanks, Roy. Thanks, Michael and Joy and Karen. Thank you for the energy. Take good
night, everybody.
Good night.
Next week.